Hi, Jason Berwick Lewis here from healthystartups.com. I'm getting ready to write a post on the big health tech trends that I think are coming up in 2013, and I just wanted to give you a quick preview of that here on the blog in this short video. So the big trends that I think are going to shape 2013 for healthcare, healthcare social media, mobile use in healthcare. We're going to see health on every screen. What I mean by that is our smartphones, our tablets, our computers, obviously, desktop computers, laptops, even on smart TVs, on smart watches, on a whole range of devices, even internet-connected fridges. We're going to be seeing this Internet of Things sort of rising up, and healthcare will be prominent on every single screen, giving us some really important real estate which people can use, startups and hospitals and doctors can use to push information, help people track relevant stats, relevant data, relevant analytics around their healthcare behaviour, around their diet, around their activity, around their exercise, and all those kind of data points, giving us really visual representations of that and easy ways to access that through visually looking at things. Google Now, which is a feature that's available on Android phones, and I think it's been baked into iOS as well through the Google Search app, is really this opportunity where cards can be pushed to us around location, around certain times of the day, to remind us to take medications, to prompt us to be active in the park, to prompt us to go for a walk while we're at work, to get up from our desks. These are some of the location-aware capabilities that something like Google Now could be tapped into if Google opens the API to other developers. For example, you could go to your doctor and your phone would know that you're at your doctor, and you might receive a reminder about asking for a new prescription for a regular medication, or advice on smoking, or whatever it is that the phone knows is your issue. Maybe because they're also tracking how much walking you're doing, how much physical activity you're doing through Google Now as well, so they'll be able to perhaps push a prompt to you to say, well, you really should talk to your doctor about how you're going about exercising. The other big thing, of course, that I just hinted at there is that mHealth, mobile health, becomes location aware. So your phone, because it knows where you are, is going to start sending you push notifications around all those sort of aspects that I talked about previously, but it might also give you a prompt if you're just happen to be walking and there's a park nearby, or there's a swimming pool nearby, or it will help you in terms of locating health services or activity services that you might wish to access based on what, for example, Google already knows about the types of searches that you're making on your phone. The last point that I just want to get onto quickly before I wrap this video up, because it's going a bit longer than I'd hoped, is UI and UX, so user interface and user experience. As we spend more and more time with our mobile devices, the real challenge is first to grab mindshare, as in there are so many apps and so many opportunities on these devices that perhaps focus on entertainment or music or video or social networking. So how does a health app, how does a health service sort of compete with that? So you've got to have a beautiful UI, you've got to have a great user experience, you've got to have something that's engaging, that makes people want to be engaged with the app and make them keep coming back to that. So UI and UX really going to be massive in 2013, but particularly not only just around apps and smartphones and tablets, but also around the whole healthcare experience. So when you go into a hospital, when you go into a medical a waiting room in a medical practice, when you're accessing medical information in printed form and online, all these kind of things are going to be really important, feeding into the kind of experiences that people are having that draws them back into their healthcare service. Anyway, that's a quick look at what I think is coming up in 2013. I'm going to be putting that in a lot more detail in a post on the blog soon. Thanks so much for your support this year, and thanks for listening. Hope to catch you in 2013. Cheers.